Hello everyone, Dr. Suneel Dhand, medical doctor. I want to share with you a rather alarming story which has started to be reported. I'm sure we're going to hear more about this as the story continues to be investigated. So today, of course, is April the 1st, and I so wish that this was an April Fool's joke. Far from it. It's an absolutely tragic situation regarding a cluster of cancer cases among staff at a US hospital in the state of Massachusetts. Let's dive into the story right here, and then we'll talk about what on earth could be going on. Nurses at a Massachusetts hospital concerned about growing number of cancer cases among staff. This was in CBS News. Nurses at Newton Wellesley Hospital, that's a town west of Boston, say they're concerned about growing numbers of cancer cases among longtime nurses who have been working on a fifth-floor maternal care ward. You're going into work every day with that feeling in your gut, and it's a lousy feeling, said one nurse. She's speaking out after being diagnosed with a brain tumor and says she's not alone among her nursing colleagues. It's getting to the point where the number just increases, and you start saying, I am crazy thinking this. This can't just be a coincidence. So that's a very good point right there. Always trust gut instinct. That's what I say. When something seems unusual, I think most people out there have a gut instinct when something doesn't make sense and needs to be investigated further. So let's dive into the story more. What exactly is going on with this cluster of cancer cases? So nurses are being diagnosed with brain tumors. She claims as many as 10 nurses who work on the floor have been diagnosed with different brain tumors over the last few months, some cancerous and some not. She says 3 have had surgery and believes the hospital has not been supportive enough. We want reassurance because this has not been a reassuring past few months for a lot of the staff members. We want to feel safe the same way we want to make our patients feel safe. Well, that seems quite alarming. What did the hospital have to say about this? The hospital confirms it has been investigating since December, so this was a few months ago, and has interviewed 10 nurses, 6 of whom it says have differing brain tumors. The hospital says no environmental risk. In a statement, a representative said that no environmental risks after we became aware of reported brain tumors in individuals who currently or previously had worked in the same area of the hospital. We conducted an extensive investigation in collaboration with the Department of Occupational Health and Safety. And they do talk here specifically about looking into radiation exposure, pharmaceutical safety, and external environmental toxins. Those are certainly the things I would be thinking about as well with any type of cluster of cases like this. Every staff member who came forward was given the opportunity to be interviewed by the Occupational Health and Safety team to evaluate each diagnosis in the context of their individual medical history and risk factors. And it's saying the investigation found no environmental risk factors. And based on these results, we can confidently reassure our dedicated team members that there is no environmental risk at our facility. I'm glad that there's been some type of investigation, but this story still seems very unusual to me. You have 6 nurses who apparently all work in a similar area and have been diagnosed with brain tumors. I mean, what is going on? I know that this story has been gaining a little bit more traction on social media, but it's a very obvious question. If something like this happens, the first thing anyone would think of is an environmental exposure. Is there a toxin, which is in common to all of these nurses? But what are the chances of that? That within a very short space of time, a large number of nurses on a particular floor or within a small area are all diagnosed with brain tumors. I mean, again, gut instinct says there has to be more to this story. So I want to get more information on this. This is evolving. More and more local news stations are starting to report on it, and I will share it with you. But let me know your thoughts down below. Have you heard of similar cases anywhere else in the United States or anywhere else in the world where there's been a cluster of cancer cases and authorities have been asked to investigate what's going on? Because the chances seem very low indeed that this would simply be by chance on the surface of things. So I'd like to get more information, and when I do get it, I will certainly share it with you here. Thanks everyone for watching. Dr. Suneel Dhand. Do let me know your thoughts down below. I enjoy hearing from all of you. Check the links in the description down below for my website and all the other work I do. Also, if you're not already signed up for my free newsletter, please do so. Hit the like button if you like this video and the subscribe button for more similar videos in the future. We will speak again very soon.